prior to the start of work by a contractor, and for all U.S. Army Corps of Engineers locations, arrangements shall be made for medical facilities and personnel to provide prompt attention to injured employees. For work or tasks with a high or extremely high risk assessment code on the activity hazard analysis, the arrangements with the medical facility shall be confirmed in writing. See sections 01.A.14. The telephone numbers of physicians, hospitals, or ambulances shall be conspicuously posted, at a minimum, on the safety bulletin board and near the on-site project office telephones. A highly visible map delineating the best route to the nearest medical facility shall be prepared and posted on the safety bulletin board. For mobile crews, the map shall be readily available. When a medical facility is not accessible within 5 minutes of an injury to a group of 2 or more employees, at least 2 employees on each shift shall be qualified to administer first aid and cardiopulmonary resuscitation, or CPR. An effective means of communication, for example hardwired or cellular telephone, or two-way radio with emergency number, for example 911, access or other emergency response source, and transportation to effectively care for injured workers shall be provided. Communication devices shall be tested in the area of use to assure functionality. Training and retraining shall not be allowed to be taken online. First aid attendants shall hold current certification in first aid and CPR from the American Red Cross, the American Heart Association, or from an organization whose training adheres to the standards of the International Liaison Committee on Resuscitation, as stated in writing, or from a licensed physician. All classes shall contain a hands-on component that cannot be taken online. The certificate shall state the date of issue and the length of validity. All first aid and CPR attendants shall be retrained every 2 years. Individuals who are required to work alone in remote areas shall be trained in first aid and shall be provided with an effective means of communication to call for assistance in the event of an emergency. Employees designated as responsible for rendering first aid or medical assistance shall be included in their employer's blood-borne pathogen program in accordance with 29 CFR 1910.1030. The performance requirements of the first aid kits shall be based on the storage area location of the first aid kit and shall conform to ANSI and ISEA Z308.1. Contents of all first aid kits shall be to the level of training attained by the responders using the first aid kit. First aid kits shall be easily accessible to all workers and shall be protected from the weather. The individual contents of the first aid kits shall be kept sterile. First aid locations shall be clearly marked and distributed throughout the sites. The contents of first aid kits shall be checked by the employer prior to their use on site and at least every 3 months when work is in progress to ensure that they are complete, in good condition, and have not expired. All employees who work where there is a first aid kit shall receive a toolbox training on the content and use of the kit supplies. The placement of automatic external defibrillators, or AEDs, is optional, except for health clinics, see section 03.C.03.D, but is highly recommended. The placement of AEDs on the worksite shall be preceded by an assessment of the time and distance to emergency medical services and a justification for such equipment. For the ease of use and program maintenance, all AEDs in a location and/or command should be the same manufacturer and model. The AED maintenance program shall be based on the manufacturer's recommendation, shall include regular and after use pad replacements, and battery replacements. All projects, activities, or contracts, USACE or contractor, where work or tasks with a high or extremely high RAC exists and which 1,000 persons or more are employed, where the greatest total number of employees on a shift, shall have the full-time services of a licensed physician.